So I'm actually going to get started, folks. For everyone who's actually watching us, just want to let you know that if you have a question for one of the panelists, in the box at the very bottom of your screen, you'll see Q&A. Just go in there and type in your question. And after we have the panel speak to one another, I'll open it up for questions and then they can respond to your questions. I will be looking down a lot because I need to look at my notes that are on my phone. So it's not that I'm doing something else, it's because I'm looking for my questions. The other thing is that you all registered, so we have your email addresses. We're going to send out more information about upcoming events. If we mention resources during this time, we'll send that information to you as well. And then I know that the Houston Institute has some events coming up. So David will mention them, but I just want you to know that you'll get that information as well. So before we get started, I do want to thank the Harvard Commons Spaces. Typically they do these events for us in person, but we are social distancing right now. So they have provided us with a virtual platform to do this. So they don't do just lectures and webinars, they also do some concerts. And so if you go to harvardcommons.com, you'll be able to see what events they have coming up. They also have a Facebook page. So if you go to their Facebook page, you'll also be able to find out information. So to get us started, I am going to introduce our panelists. And the first one that I have is Cristina Dr B Villarreal. She is proudly born and raised in the Bay Area. She spent nearly a decade teaching and learning with the beautiful youth of East Oakland, California, where she taught middle school social studies and served as an assistant principal. Currently, V serves as the faculty director of the teacher education program at the Harvard Graduate School of Education, where she also teaches courses on ethnic studies and healing-centered engagement in classrooms, schools, and communities. She also serves as a radical healing trainer with Flourish Agenda and as a consultant with Acosta Educational Partnership. She holds a BA in Ethnic Studies from UC Berkeley, an EDM from Harvard University, an MA in Ethnic Studies from San Francisco State, and an MPhil in Education from Columbia University, and a PhD in Social Studies Education from Teachers College, Columbia University. Her research explores enactments of humanizing pedagogies, racial literacy, and radical healing in secondary classrooms through portraiture. When she's not teaching, which is completely online these days, she can be found baking cookies or cupcakes, eating a huge bowl of noodles, or cuddling with her new dog, Ikla. Everyone, that is Dr. V. Next, we have David Harris. I'm gonna say Dr. Harris, even though he's gonna say, don't call me that. He has been the managing director of the Charles Hamilton Houston Institute for Race and Justice since 2006. Under his leadership, the Houston Institute has created a national platform with its Houston Marshall Plan for Community Justice. An initiative seeks to change the way public policy is conceived and implemented. The project is designed to amplify the voices, knowledge, and expertise of people living in communities devastated by decades of underdevelopment brought by the war on crime and the war on drugs. The Institute's work is based on developing partnerships with others. Sorry about that.
Just stop.
Emphasizing the directly affected and those working with them. And I just want to say this last paragraph, David. The Institute has served several projects, because I'm really excited about these projects. They have several projects underway at this time, including work with the Beloved Streets of America project, designed to renew and revitalize the hundreds of streets named after Dr. Martin Luther King Jr. This work is a kind of mini Houston Marshall Plan, which are along these corridors of MLK. The Institute has also launched its Just Flicks project. This is a new project, it's amazing. It works to link college and high school students to create short videos using their cell phones to document social justice, social service, and activism in their communities. So I won't go on, David, I'll spare you that, but I felt like they needed to know.
Because I'm gonna come back to all these people here to get some of that.
Now I have my good friend, Bhishan Knowles, who has served as the Director of Community Engagement at the Harvard Chan School since 2015. His work includes developed relationships with residents, local advocacy groups, and community-based organizations to enhance community-engaged learning and scholarship opportunities for students and faculty. He co-leads the Leaders in Health program, which strengthens community health initiatives through an introductory training in public health research and science. He is a lecturer for a course on community-based participatory research that provides an alternative research paradigm which integrates education and social action to improve health and reduce health disparities. Bhishan also serves as a core committee member of the Deborah Rose Service Learning Fellowship, which funds rigorous service learning projects, which are designed to address community-identified needs, working in partnership with community partners and public health graduate students. He sits on several research community advisory boards, including the Harvard Chan Preventative Research Center on Nutrition and Physical Activity, and the Northeastern University Harvard School of Public Health Injury Control Research Center. Previous to his role at Harvard, he was a program manager at the Boston Public Health Commission, where he led the Peer Leadership Institute. His professional background includes more than 15 years working with Boston area community-based organizations with an emphasis on youth development and community organizing. He has worked as the Grove Hall Youth Worker Alliance Coordinator at Project Right, where he supported and counseled court-involved and at-risk young adults. He has been acknowledged for his community service by the Action for Boston Community Development, the Boston Foundation, the Boston Police Department, Suffolk County District Attorney's Office, and the Harvard Youth Violence Prevention Center. He holds a master's in public administration and a Bachelor of Arts in Community Studies, both from the University of Massachusetts, Boston. He is currently a first-year doctoral student, and his research interests include community academic partnerships and service learning. He also coaches youth basketball and soccer. So last but not least is the Teachers Lounge. And if you don't know about them and you're a teacher educator, go onto Instagram, Facebook, and look up the Teachers Lounge. It's an amazing organization. And I'm going to tell you about Devin and Jabari, who actually started the Teachers Lounge. They developed the Teachers Lounge in 2018. They began this work because throughout their own K-12 and college experiences, as well as in their professional careers, they witnessed the underrepresentation of educators of color in lead teaching positions. And they felt the effects of not having a teacher with whom they could identify and see themselves reflected. Together, they seek to change this reality for future generations of students by creating and curating spaces intended to increase the recruitment and retention of educators of color across the greater Boston area. So I'm going to start with Devin. Devin Morris received his marketing degree from Boston College in 2005. After gaining over 5 years of experience in footwear design, product development, sales, and website management, Devin went on to receive a master's in business administration from Babson College. He focused on social entrepreneurship and rediscovered his passion for education. Now in his 10th year in education, Devin has held roles in teaching, coaching, mentoring, school leadership, student staff recruitment and retention, marketing, and development. Devin has a passion for community engagement, program development, execution, and evaluation, along with his proven public speaking skills. His experience in business have prepared Devin well for challenging yet rewarding marketing campaigns that he leads with the Teachers Lounge. If you haven't seen their marketing campaigns, they're incredible. And then I'm going to end with Jabari Peddie. Jabari attended Morehouse College, where he earned a Bachelor of Arts in English and Language Arts. Shortly after graduating college, Jabari attended a Media Advertising and Sales Institute at Howard University. He began teaching in 2007, and he taught for a total of 5 years. 2 of those 5 years, he served as the chair of the English department. Jabari has a sound understanding of curriculum design and best practices for rigorous instruction. He has been a school leader for 7 years, of which for the past 5 years, he has served as a principal. Jabari was the founding principal of the largest turnaround school in Boston. Jabari is a talented and proven leader of people, and he is adept at organizational strategy and operations. Jabari is currently enrolled in a fellowship in the Boston College's Lynch Leadership Academy, where he is honing his skills at adaptive and technical leadership. So folks, those are our panelists. And if you don't know me, my name is Tracy Jones. I'm the Director of Diversity, Inclusion, and Belonging at the Harvard Graduate School of Education. So like I said, this is about the community, so I'm not gonna do a lot of talking, but just to get us started, I wanted to talk about an online discussion about race and health that I was about 2 weeks ago. Robert Sampson, who's a professor of the social sciences at Harvard, stated, "The coronavirus is really exposing class and race-based vulnerabilities, particularly in the form of what I think of as a toxic inequality, especially the clustering of COVID-19 cases by community." So what does this statement mean to all of you, and how does it impact your daily life and the work that you do in the field? And could you, when you answer, speak to the toxic inequality that Sampson is referring to? So to get started, David, I'm gonna ask you to answer that question.
You gotta unmute yourself, David.
Too much technology. So thank you, Tracy. No, I mean, Professor Sampson's comments certainly resonate with my experience and with our work. You know, for many years, he's been documenting this toxic inequality and certainly knows that of which he speaks. And in fact, it's been apparent, it should be apparent to anyone who has paid attention that this has characterized the national landscape for many, many years. And, you know, in thinking about this, I remember the Kerner Commission 50 years ago, a warning of growing inequality that faced our nation and the need to work on the conditions that define what they called ghettos. And, you know, I think our failure to heed that call has led to the current conditions of under-resourced and underserved communities, you know, with a wide array of institutional actors, you know, kind of responsible for this. You know, there was this kind of, you know, and again, forgive me for doing a little bit of history here, but there was this benign neglect that Richard Nixon gave us, you know, many years ago. And, you know, it was designed in part to actually start this process of underdevelopment. That was a long time ago. And since then, you know, it's continued with systematic isolation and deprivation, you know, policies known as the war on crime, war on drugs. You know, and these wars, you know, have been thinly veiled in their racism. And I need to be clear when I say that, you know, I mean kind of institutional determination to maintain the primacy of white power and privilege. That's what I consider to be racism. And these policies that have been meted out on our communities for decades have done that. And that has created a great deal of toxicity. Now, a lot of us have heard about Michelle Alexander's new Jim Crow, and we think we decry mass incarceration, and we know and recognize that that's a part and parcel and outcome of these policies. But, you know, she and many others, including Professor Sampson, have pointed out that despite the devastation to our communities is much greater than the perversion of the legal system, right? So, you know, for a couple of decades now, we've kind of understood this notion of the social determinants of health, right? And understand the overlapping ways in which inequitable social, political, economic, environmental, and health policies have actually made us sick and made our both individuals and communities. And we've known of this toxicity that we perpetuate, but we've refused to follow the Kerner Commission's mandate to address its root causes. So yes, you know, so as part of our work at the Houston Institute, you know, we followed the wisdom of Charles Hamilton Houston, who sagely advised us that all our struggles must tie in together. And so we think about the myriad kind of institutional forces that combine to create this toxicity and the inequality at its root. You know, we see another devastating effect of these policies, and I'll close with this. I mean, I think, you know, it's not only, you know, our physical health and our social health, but there's a way in which these policies have denied membership to entire communities, both as individuals and as communities. And this has in fact contributed to the toxicity that we face, and is really one of the primary problems that we have to address, and that we at the Houston Institute try to work on.
Thank you for that, David. Does someone want to jump in there?
I'd like to add, and thank you, David, for touching upon the social determinants of health. When I read the comments, I couldn't agree more with them, but I also asked myself, exposing these vulnerabilities to who? Because in many ways, folks that live in these neighborhoods, you know, they've been historically marginalized. When you think about how David alluded to with how we responded to heroin in the 70s in the Black community, how we responded to the crack epidemic. And so there's not only the impact of negative health outcomes of these racist policies that exist, but also the responses are racialized as well. And if you, and just to go back to the social determinants of health, if you just think about the conditions of many Black and brown and low income communities, if you look at the housing conditions, the physical environment, the lack of green space, the lack of places to buy healthy and affordable food, the access to quality schools and a quality education, none of that is new. I think the biggest thing is that now it's on the front lines every day. So folks that have ignored it are seeing it every day. And now it's like, oh, what is going on? And no, our communities have been facing these issues since we've had our communities, and now is the first time that mainstream media is highlighting these on a daily basis.
The statement from Samson made me think of a quote by a writer, a professor by the name of Amiri Baraka, and the quote is the torture of being the unseen object and the constantly observed subject. We are studied out of convenience, not out of care. And so what David and Rashawn are speaking to, this literal toxic inequalities that have been exacerbated, not created as a result of coronavirus. And I think a byproduct of white supremacist culture is this, like you need numbers, you need data, but like we got the data now. And so before you have the data, you don't have a problem. Now we have the data. The question is what action steps are being taken to address this. But the reality is that the data now, again, is exacerbated, but it wasn't created now. So when you have Cuomo talking about pre-virus deaths or in-home deaths were roughly 20 to 25 per day, that's not insignificant. So why is it now that seems minuscule when we're talking about 200 plus deaths, in-home deaths per day. But that wasn't insignificant when it was 20 to 25. And so the question just becomes, when we start to talk about these communities that are at risk, our communities that are at risk, what are the steps now? We have the data, we have the information. What are we doing to support those communities in need?
You want to jump in?
Yeah, I'll jump in. And David used the term like benign neglect. I would even dare to say that it's malignant neglect, in the sense that it's very intentional what has happened to the communities that are most affected by the coronavirus. And I think specifically through the lens of a school leader and in the context of schools, where I serve predominantly Black and brown communities, of which the majority are on free and reduced lunch. And I think about that as a barrier to their being able to access the remote learning and instruction that we are providing to them. I think about like the multitude of barriers that exist as a result of the current and actually the pre-existing climate and conditions. When I think about what is happening in the homes of our families, many of our families are in the service industry, so they are still having to go to work every single day and risk exposure and risk bringing that back home. But what that intensifies is students are being left at home essentially, or living in environments with their older siblings who then have to take care of them, and they are then having to like raise them and provide some sort of tutelage, if you will. And so that in and of itself is one of the manifestations of this toxicity that Samson was referencing. And it's just forced the schools to really think creatively and innovatively around how can we use our students' geography as an opportunity to teach learning, and not just look at the geography in which they live as a detriment to their existence and their ability to flourish.
It's been frustrating to hear that, oh, this virus has exposed. And I think it's, I'm just repeating what a lot of folks have said, is it's been exposed. People just haven't been paying attention. So I think it's refracting and shining a different lens and light, right, through the lens of the virus, a long overdue opportunity, I think, for this country for a national reckoning with the toxicity of structural racism and inequality. And that my hope around it is, how might we take this up? Because I've been asking myself, okay, how many more historical crises do we need to face for us to finally actually face and authentically commit to the radical healing that has been necessary? Because we can pull so many examples already, just even in this conversation, we have so many examples throughout history. My fear is that this will be another missed opportunity. My hope is that we can lean into it around one of the things we were talking about even before we started was an opportunity to really focus on and center the physical, the mental, and the spiritual health and well-being and healing that needs to occur. So when I hear that, it is both, it's frustrating because it's a reminder of all of the very explicitly ignored opportunities that have presented themselves previously. So that's where I'm at with it.
Thank you all for answering that question. I'm going to throw in something from our audience. And the question, and anyone can answer this one, is how much do you think this current attention to the overrepresentation that Black people are dying from COVID-19 is merely a political mechanism?
Well, I would say I don't think it's being overrepresented in the data. I think that the data speaks for itself, and I've seen efforts from folks like Ayanna Pressley to disaggregate the data by race so we can know really what the impacts are. I think how it's framed is racialized. So regardless of, we do need to see the real data to know the impact it's having upon our communities. But of course, the media and politicians racialize and frame it in a way that makes it seem like it's other folks that are spreading the disease, other folks, people of color, that have created the disease, that are the carriers of the disease. And I think that's more troubling. And even how it manifests in the day-to-day experiences. And I live just outside of the city of Boston, and we're a city that hides from our racist history and our racist reality. But just walking down the street amongst some of my white neighbors, I don't know if they're being more avoidant of me because of social distancing or because I'm Black, or if it's a combination. And like my wife and I, we had our kids and we seen someone like literally stop about 30 feet away from us and say, social distancing, social distancing. And I was left, like my son who's 7 was like, Daddy, what was that all about? And in a lot of ways, I wanted to explain the realities of social distancing and COVID, but I really thought it was racism. I was like, I think she was scared of us. She's scared. She looks at us as the carriers, not as that she could possibly infect us. So, the media and how they frame these messages is very, very, contributes so much to the toxicity and the hate that spreads through systemic racism.
Anyone else want to jump on that? So I'm going to go back to one of the questions I had, and this is for the educators on the panel. I was recently listening to a CPS teacher give a testimonial about what teachers are experiencing while they're trying to teach virtually, while they're experiencing COVID-19 as themselves with their families, and as their students are experiencing sickness and death. So how do you especially Jabari and Devin, how do you talk to teachers, educators about what's happening right now, and how do they support their students as well as themselves during this time?
One thing that I've been telling my staff and using a bullhorn to tell them is you have to take care of yourself You have to make sure that you, as a care provider to our students, you have to make sure that you are sound and you are whole. And so it's really important that they are tending to their wellness throughout this period, being responsive to their family, being responsive to their own bodies to make sure that they are healthy. And when I talk about healthy, I'm talking about like a coherent healthy, mind, body, soul, so that they can be present for their children. And what we have elevated as the priority in my school is being attuned to the social and emotional well-being of our students, and making sure that we are being the ear and the shoulder for them, making sure that we are being responsive to them and their needs, and still viewing them from an asset-based lens and not pitying them for the environments in which they are living. But we have, in many ways, centered social and emotional learning and put that on a parallel track with this idea of equity, and doing everything from the way that we design our lessons, our asynchronous opportunities for our students. We make sure that it is as accessible for all of our students to consume in a way that still does promote their learning and equally attends to making sure that they themselves are healthy.
Just to add to that, our people are dying, right? So under quote unquote normal circumstances, educators of color bear an invisible tax of working with students and families of color. We're asked to, and often want to, build and strengthen connections with students and families of color, and sometimes often on top of our shared responsibilities with colleagues. So once again, inequity is exacerbated under current circumstances. And so current circumstances don't just simply require a check-in in the hallway with students, the way that we would operate sort of in school buildings, or a quick call home for a progress report. And so we are personally and collectively impacted and experiencing both primary and secondary traumatic stress. And so the piece that Jabari is talking about is, and what we've been doing, I think Jabari's talking from a school-based position, what Jabari and I have been doing very intentionally during this time is listening to our educators of color, and hearing what schools are currently providing, what they're not providing, what it is that they need through a professional lens, but also from a personal lens during this time.
Via, I'd like you to answer that question. And as someone who educates educators, and in about 5 or 6 weeks, you're going to send out 25 folks into schools. What are you thinking about that in terms of preparation?
I'm thinking a lot about their humanity, and how their humanity and the humanity of our young people is what's at stake. And that we need to be very explicit, trying to be explicit as often as possible in naming this collective trauma that's impacting every single one of us. Because oftentimes, I think there's been a lot, right, floating around the internet around capitalism, productivity, and those types of colonial ways of thinking seep into our practices in classrooms. And we oftentimes can forget to allow our humanity to show up in our work. And that humanity it looks like vulnerability, it looks like fear, it looks like uncertainty. I don't have the quote with me, but I want to reference my good friend Marilyn Zuniga, who is a elementary educator in Oakland, California, who wrote a beautiful statement on what it means for her in this moment as an educator, as a woman of color, to surrender, and what it means to exercise surrender as a form of, I think, really powerful agency in this moment. And we don't have those types of, I think, conversations enough, especially with what we were already up against as educators of color and what we're up against right now. And so a lot of the conversations, I think, have been around some of my students in the course I'm teaching right now. I appreciate have posed a question around not just where are we going, but what do we also refuse to return to? These ideas around what we already knew what a lot of these crises were. We knew the ways in which we were disproportionately impacted. How do we also in this moment develop a stronger awareness of and a refusal to return to those things, while also manifesting what we want for our students that's deeply rooted in our shared humanity, is a lot of, I think, what I've been trying to focus on. right now, prioritizing their health and well-being, which is hard in this moment where things have to get done. There's also a lot of emergent data, and I should say it, that distance learning is not working, and we need to name that, and we need to have conversations about that. These attempts to just take what was and then insert it into the virtual space, it's unnatural. And we're not taking the time, we're just moving, and it's right. It doesn't matter. It goes right back to that baseline intention versus impact. When we look back at this moment, young people are going to remember how we made them feel in this moment, and teachers are going to remember how we made them feel in this moment. And were we honoring our baseline humanity or not? And that's what's at the top of my mind and heart in every single conversation that I have with educators.
Thank you for that. There's, all three of you, that was powerful. And, it made me think about the community side, right? We're talking about the educator side, and I'm thinking about the community side. And David, when we think about the Houston Marshall Plan, could you talk about how you use that during the time of COVID-19? How do we engage with that? And if you could just share a little bit about the plan for people who are not familiar with it.
Sure. As I was listening, and as I've been thinking about this, I go back to where this plan came from in the first place. And if you'll bear with me for a second, for years, since the inception of the Houston Institute, we did work on race and the death penalty. And in the early days of the Institute, we were thinking about this question of who about the racial disparities in the death penalty. And so I would give these talks and I would ask people, what's the most determining factor in terms of the death penalty? And people would shout out race gleefully, right? Like of course it's race. And I say, yeah, what about it, right? and they would say, well, black people get the death penalty more than others. And the fact is that might be true, but the determining factor was the race of the victim. And it was, if there were a white victim, you're much more likely to have the death penalty. And that led me to understand in a very profound way something that's actually kind of playing out in today's crisis, and that is that white lives matter, right? So long before there was a movement for Black lives, we had a system in this society in which white lives mattered. And the legal system and all of our systems were oriented around that premise. So the Houston Marshall Plan grew out of a notion, and it's the Houston Marshall Plan for community justice. And community justice is the key here, because it grows out of a question about what kind of society are we that devotes all the kinds of resources that we were devoting to the death penalty while entire communities of color go unserved, right? And the answer to that is a racist society, of course, but also an unjust society. And so, we started to reframe the question and start to think about how do we change the way in which public policy is made? And how do we do that? And the way we do that is we start to center the voices of the people affected by those policies. So quite simply, the Houston Marshall Plan for Community Justice is designed to rebuild our cities in the face of the destruction wrought by the war on crime and war on drugs, in warlike fashion. These were wars that were fought by our people, on our streets, right? How do we rebuild from that? Well, we rebuild from that by centering the voices, the knowledge, the expertise, the assets of people in communities affected, to determine, the needs of the community and the things that are working. All right, so that's it in its essence. But there are a couple of pieces to it. I mentioned earlier this kind of question of membership. So the entire thing is anchored on an understanding of citizenship as meaning membership and participation in society. Right, those two things, and they're interactive. And our society, this nation from before its founding, has been based on exclusion, right? So look, I won't go into a lot of detail, but I talk about this notion, this we the people, right? As our founding lie, right? It was never we the people. Even when that was said, it was based on exclusion. And so the Houston Marshall Plan is trying to say, well, wait a minute. let's see if we can, in fact, make it we the people, and we the people includes us, right, as the policymakers. And so the idea is that we need to find ways to amplify the voices of those who are doing this work on the ground, and start to think about how to mobilize them to marshal resources to accomplish the goals that they have, and so, you mentioned a couple of the projects we have going, but the thing lives on a website, and the idea is that there are people, in every community, every city in this country, there are people and organizations doing this work on the ground, right? And the idea is to identify them and kind of name them and record them, so that, if you're a person in Tacoma, Washington, interested in the relationship between childhood obesity and trauma, you could look up what somebody maybe did in Topeka, Kansas on that, and start to share that information. So it's a matter of starting to take control over the public policy conversation and dialogue, and presenting policymakers with the kinds of alternatives that we'd like to see. That is that's a form of participation that we encourage. And the two things that you mentioned, the Just Flicks, I think the Just Flicks idea is very much designed to think about ways we can get young people engaged in this process, to use their voices to identify who's doing community justice type work in their own lives. And I'll stop by saying that as an Institute for Race and Justice, we actually think a lot about what justice itself is, right? And when I give talks, I often ask people to think about it for themselves, and it's a difficult question. And I know if my colleagues on this panel and all of you out there in internet land think about it, it's not an easy question. But I'll tell you what it's not. It's not criminal justice. Right? It's not what we call criminal justice, which, kind of reinforces an association between Blackness and criminality in ways that are just, that you talk about toxic, right? So we have an operating definition of justice as to be made whole, right? To be made whole is that's what I think of as justice. And given that framework and that way of thinking, it changes the entire way we think about what we do. Right? It puts the emphasis on restoration rather than punishment, right? It puts the emphasis on health rather than danger, right? And it frees us to start to think about different ways to conceive of public policies that address the needs and desires and aspirations of people on the ground. So, that's a long-winded answer, Tracy, of a little bit of the Houston Marshall Plan.
Yeah, I appreciate that. I want to get to something that someone put in the chat, because I think it's important. The person said, I'm hearing people talk on the disparities of people of color. Could you speak on how the education level of our community affects our survival skills? So they're saying the only people who I see speaking on this are intellectuals with PhDs, doctorates. I don't hear from these people who end up in jails or dead. And that's not the talented 10. So, I'll just speak to the point. I was just talking to my mother the other day, and she's like, you have 1 foot out of the ghetto. You're about 2 paychecks away from where you came from. So in a sense, and I can't speak to the other panelists, you can respond to that, excuse me, my cough. My education level is still tied to my community. I'm still tied to my community. And I think that's why we put this webinar together, because I also am tied to Harvard, and I'm complicit in Harvard and the systems in which it perpetuates. So I want to name that, but I would love for you all to speak to what this participant is asking about in terms of education levels of our community and how it affects survival skills.
I don't have a long-winded answer. I don't know about survival skills. We've been surviving. So I don't know if that's the crux of the question that the person is asking, but it certainly impacts access. And so I don't know if the person means beyond that when they talk about survival. I think that's a distinction that I would just make.
I would jump in and say that when I think about those who seem the least informed right now are the people who are not within our community, the people who are lobbying for the states and cities to be opened up sooner without proper data. I would lobby that those are the folks who are misinformed and not us. And to Devin's point, like, we have been adapting since we became enslaved people and put on those ships and brought over here. So I don't think that's what the issue is. It is very much about access and the speed and urgency with which this information and these resources are being deployed into our communities.
Yeah.
I think I would add too, one, first time someone's ever called me an intellectual, so I thank you for that. But
Right.
but second, and more importantly, I think as the two previous gentlemen stated, the access, you know, having a higher education is closely correlated, one, to having a job and a better paying job. And what comes with that, you know, is it, you know, like I look at myself and having a job that has granted me the flexibility to work remotely and to keep my same salary. My job sends me a lot of information about what I can do to stay healthy, and not everybody has that. And so I think if you're talking about education and resiliency, they're two different things. And education is not just the formal PhD, doctorate, whatever you want to call it. Our people have exhibited and displayed tremendous education, knowledge, strength, and resiliency throughout time. And so I would just challenge that notion of survival. And really, it's kind of a form of victim blaming in a sense, and it's more our racist system has continually and deliberately put people who are less educated, who are less wealthy, and who are not white in these situations.
To quick add on to Rashawn's, just to back it up with some data, the Bureau of Labor Statistics did a survey, and the survey reported 20% of Black workers and 16% of Latinx workers are able to work from home, which means 80% and 84% respectively are essential workers or unemployed, right? And so I think this goes back to, I think, something Jabari said earlier, David, I think you said it as well, is this idea of like, you have to go to work and risk sickness or stay home and risk not being able to support your families. And then the trickle effect are what is happening to students during that time. And so there was just the data that stood out to me based on your point, Rashawn.
I feel like I want to respond to both parts of that question. When I think about like levels of education, I think about immediately like, well, what types of education and curriculum has been criminalized or withheld from our young people, and what is deliberately ignored. And I think about this in terms of all young people, not just students of color. I think about white students as well. Because when I see things like the protests that happened this weekend, my question, one, I'm irritated. I'm frustrated and irritated. But as a teacher educator and as somebody who just believes so much in the possibilities of classroom spaces, my question was like, damn, who are their teachers? Because my heart tells me if they had strong history teachers, they wouldn't engage in such stupid behavior, like period, the end, in the same ways that our classrooms can absolutely be spaces that not only equip young people with the ability to critically, right, analyze and name their realities, but to transform them. And that teachers that have done that, what have happened to them? They've been criminalized, pushed out of classrooms, ostracized, stigmatized within their schools. They get hate mail. And so I think those are also conversations, right? The teachers that are organizing to stop, right, standardized testing, the ones that are organizing to stop EdTPA, over 3,000 signing a petition, right, across many states, started in California by 3 women of color. So I think about in those ways what has been criminalized and what has been sanctioned, and importantly, why. So in terms of that around our levels of education, that being also very much tied to like a very deliberate structural like apparatus in how education is given in this country. There's that. In terms of, I think, who is in dialogue, and especially I want to go back to like even the title of our panel, right, is holding Harvard accountable. I do want to be clear, right, that that's like a real tension. I struggle with it. I often go back to something, right, that Dr. Sarah Lawrence Lightfoot taught me, is that I might be at Harvard, but I'm not of Harvard. And that my accountability, Lee Patel says, you could be loyal to people, but not institutions. I know that I am disposable. And because of that, my accountability is not to this institution. My accountability is to the young people of Boston, Cambridge, and Somerville, because that's where teachers are teaching. And in that place, and operating from that place, my job is not to come up with the ideas. My job is to listen to them. So I want to make sure that I name that piece too, that I definitely am not coming to this panel with all of the answers. I think they're offerings, and hoping to engage in more dialogue with the participants, because I'm taking a look at the chat and it's lit. I want to talk to people.
Hey, can you answer this one then? And Jabari and Devin weigh in on this. Who needs to be in power positions to make these changes in classrooms? What are those power positions? Why is it so difficult for the more progressive, equitable educators to get into these spaces?
We hire who we know. And that has been a test of time, right? And so if we continue to hire, and there are standards or skill sets that don't often get boxes checked. And so when we think about long-term sustainability, when we think about development of relationships with students and families, and a deep desire and belief that students can be successful, that is not often prioritized in both hiring and in promotional activities over some of the more tangible, organization skills, response to email, timely response to emails, lesson planning and whatnot, which I think are skills that you can actually develop. And I think that the skills that I have yet to find the school leaders who can develop teachers to build authentic two-way relationships with students and families. I don't think you can coach someone to believe that students can be successful. And so I think that those are the things that often get prioritized. And I think often those in positions of power now look to hire themselves. And so they're looking down these sort of similar pipelines instead of sort of opening up new pipelines, which is the work that Jabari and I are attempting to shift and to highlight and lift up some of the voices and experiences of folks who I think Rashawn said earlier, we may not be, I'm not an intellect. I'm no expert in anything other than my own experiences. And so that doesn't mean that we don't deserve seats at tables. It doesn't mean that we don't have a deep rooted passion for the success of our students and communities.
I want to respond to that question in two parts. The positions of power, those power positions that you bring to this conversation, I would say a quick little anecdote about myself is I taught for 5 years. I served as grade level chair and department chair in English language arts. I then transitioned into being a dean of students. And if you know anything about the charter world or just ed space in general, typically Black and brown people are put into the positions of your dean of students, your culture roles, primarily to police the little Black and brown babies. And I quickly saw that as a manifestation of racism, right, and prejudice that existed in my school. And I was refused to remain in that position. And so what I was intentional about was advocating for myself and saying that I wanted to be an instructional leader. So I'm drawing the bold line between the power position is that instructional leadership role, are the people who are responsible for designing and developing and distributing curriculum. Because when we think about culturally responsive teaching and radical pedagogy that we need to make systemic change, it happens with those people who are the pen to the paper and writing and drafting the curriculum. So I would say that is the power position there, because you are directly responsible for what you are facilitating in your classroom and making available to our children. And when I think about why are those educators who are progressive or equitable as was quoted here. The reason why those people are people who fall into those categories, it might be more challenging for them to make progress or scale that ladder, is because the ideas that you're presenting are radical, right? And the ideas that you're presenting are a direct affront to white supremacy. And when that exists, like, people don't want to see you moving forward, because you are, again, a threat to this perfectly designed system of oppression and this perfectly designed ecosystem that is intended to subjugate Black and brown people. And so that is why it is more challenging in my estimation. That's what I found to be more challenging. And as I traversed and navigated my way to being the principal of now 3 schools.
Tracy, could I come back to something, Tracy, real quick?
Yep.
And it's 2 questions ago, because, and I think B, you kind of brought this up. I mean, I do think that, and Tracy, you got me in trouble when you called me a doctor, you see, so now you're going to call me an intellectual. But I think when we talk and think, as we are here, about holding Harvard accountable, you know, and I know we're going to get to this in greater length some other time, but I think part of what we have to do is understand and recognize that we are not the experts, right? And it's very difficult in this perch from this place to convince, you know, we might believe that, to convince our colleagues that in fact they should be listening to and paying attention to somebody else, not us, right? So I see really my job and my responsibility very much to make that argument, to say, no, I'm not the one you should be listening to. There are other people, you know, who have the knowledge and you know, of what's going on, who we should be listening to. And part of holding Harvard accountable, I think, has to do with how we insert those voices into the considerations, and how and whether we can put what Harvard has at service to that. So I'd also like to share, you know, I have a colleague here named Derek Northington, I have to give him a shout, who has an incredible MLK quote on his signature, which I'm gonna have to read. And he called it that we have to recognize that they who are the greatest among you shall be your servant. That's a new definition of greatness. It means that everybody can be great because everybody can serve. You don't have to have a college degree to serve. You don't have to make your subject and your verb agree to serve. You don't have to know about Plato and Aristotle to serve. You don't have to know Einstein's theory of relativity to serve. You don't have to know the second theory of thermodynamics and physics to serve. You only need a heart full of grace, a soul generated by love, and you can be that servant. Now, I mean, so Dr. King was an intellectual too, right? Don't kid yourself. But what he's saying there, I think, is something that we need to bring into the conversation here at Harvard. So we'll come back to it, but I do think the question was a perfectly valid one, and it's one that we, you know, I think we really have to engage directly, and I appreciate the question.
One just came up in terms of holding Harvard accountable. So in what ways can the Harvard folks on this panel bring the voices of the community experts before the necessary audience and power? What are the aspects of our roles that can be facilitated in this process? I know you speak to this all the time, David, so if you can continue on.
I don't want to, I'll just say this and I'm going to stop. I mean, because one of the things that I wanted to do in this conversation was call out a colleague of mine named Monica Cannon Grant, who works and puts her life on the line, every day and for years and years and years. And as far as I'm concerned, her voice is the voice that I think we should be listening to. It's the voices of people like her. And so I see my job and my responsibility to make sure that voice is heard in the corridors of Harvard and in the decision-making chambers of City Hall and legislature and whatever, and that we start to think about her wisdom and her experience. So I mean, but it's a constant, you know, it precedes this, but I think it becomes even more important, you know, and we should talk about this. We get to how we make sure those voices inform where we come out the other side of this pandemic.
So I want to honor some of the voices that are here that I didn't get to ask you question. This question is focused on race. Just give me a moment. And the person asks, could you talk about Black young men in particular who are wearing these masks during COVID-19 and how that's being represented in the press? Anyone can answer that.
I'll take a grab at it. You know, I read some of the op-eds and some of the blogs that had were well written and really on point on the concern of being particularly a Black male and wearing these masks and going out into public. And it wasn't until I went out, you know, and it really struck me that, like, wow, like I'm about to walk into this store masked, you know, and what does that mean? And, you know, and I don't think the media has done a good job, but I think individuals have done a great job at airing their feelings and their concerns, and it's real. And I think, you know, like the threat was real pre-COVID-19. The threat is, you know, even more concerning in our current reality. And, you know, and it was really tough for me when I went out this past weekend with a mask. Like everything I've been taught not to do, you know, in a lot of ways, I was doing it, you know. Every fear that I had of being pulled over, you know, I don't have access to medical equipment. So my wife gave me a bandana and I was like, I can't do this, you know, like what am I going to bring upon me by wearing this bandana? So I think it's very real. Yeah, I'd like to hear from some of the other brothers too on your thoughts, and my sister, Dr. V, as well. So.
I don't know if this is part of the question. My fear is actually on the back end of all of this, because as Rashawn noted, we it's been proven we can't wear hoodies in public, right? So when we think of this time period that is on the horizon of shelter in place being lifted, what we know is that house to house, like the fear will still be present, the concerns will still be there. And so what does that mean for young men of color who are actively protecting themselves as like, but now we're attempting to return to normalcy. I think that's the thing that I'm even more scared of than at present, right? Because that same young individual who walks into the store, there are many others who are wearing masks. I think on the back end of this is where I'm fearful.
And just to add, even as young people, especially navigating in the city neighborhoods, you know, there's that double risk, you know. Not only is there the risk of going into these stores and from police, but also in your neighborhood, you know, like it's not safe for some people in general. And then wearing a mask, you know, it adds this level of complexity that a lot of folks aren't aware of. So to be 17 and having to venture out into my neighborhood masked, and the threats from police, the threats from neighbors, the discrimination that I probably already experienced, and threats from others in the community that may want to harm me, you know, it's just really, really complex.
I would just encourage, and I've been encouraging people to watch the videos. I think that young people have been doing a powerful job of documenting the ways in which they're being racially profiled, harassed, assaulted for trying to protect themselves, and being very clear in naming it. And I think that becomes a vehicle to center those stories, their humanity, and what's at stake. That's my immediate, my immediate reaction, because I think it's terrifying. I think it's horrific. And as like somebody who early on didn't feel safe, as just like an Asian American woman, and how people moved away from me, and that's changed now. Like, no, people aren't treating me. I remember there was a distinct shift. People aren't treating, but there was like a nice 2-week period where I got the looks, and now right? That has shifted. And so I think in each and every moment, we have these opportunities to, especially I think for folks who don't have that experience, and to ask those questions. And in those same ways for teachers to be able to ask those questions and to have those real conversations around what are the choices and what are the actual very real risks when we're not protecting ourselves, but that when you put yourself at risk by covering your face. I think like those are very, very real conversations that need to happen in a variety of contexts to, I think, generate the dialogue that's necessary, I hope, to move us forward. But I'm frustrated. I'm frustrated because it seems like these conversations and history continues to repeat itself in deeply toxic ways. And this is another iteration, right? In the way that Devin cited hoodies. Now it's masks. And again, where, like, how can we lean into this opportunity as educators to have those conversations with everybody, not just with the kids, but with every single person, especially those that are so removed from it and don't even have to think about it, don't even have to think twice about how they move through spaces, and to ask them, have you been followed? I think those conversations need to happen, because I think the virus allows this, like, that nobody is exempt. The virus, right, nobody's exempt from it. And so it allows an opportunity, I think, to have a more collective conversation.
And parents who have to make decisions, I'm just expanding on what you just said, Christina, to having those conversations with parents who have to make a decision on which is more life-threatening for my child, to send you out into the world masked or unmasked. And that's not a decision that folks should have to make.
Now, I want to follow up on that race-based question, because someone said, how are you all dealing with responding to Asian American aggressions that we're actually seeing right now? And I would say responding to the youth, in your classrooms or policies with your teachers. Just wanted to put that out there.
We've done a lot to educate our students, our families, and our staff around all details relative to the coronavirus, from its inception to its spread and to its devastating impact in our communities. And the best tool that I've ever found to confront any type of racism is education, is using instruction as an instrument to really rewrite the narrative for the experiences that people are going through who are at the blade of any type of racist actions. So that's what we've done. We've made information incredibly accessible to our families, to our students, and to our staff.
Tracy knows that I love to draw on history. This is not the first. I mean, we have so many examples within our recent history in which racialization has led to violent practices against targeted communities of color. And so I think that goes right. I think that builds right on Jabari's point around how can we use this again as an opportunity to have or center those conversations in classrooms, because this moment, how are people going to look? And I think that young people are already driving those conversations. Teachers are already driving those critically conscious teachers, let me be clear, are driving those conversations around how does our behavior in this moment, how is it going to define us? And how will we be characterized in the future for how we respond now? And we can compare that. We can look at Japanese American incarceration, right? We can look at the Chinese Exclusion Act, and we can look at the initial response and the anti-Asian behaviors that immediately followed and were driven, right, by, you could see, you're talking about a primary source document that I will absolutely have history teachers using, that Trump speech where you saw every time coronavirus crossed out in the word Chinese. Like that, you put that in front of young people, they will analyze we have so much evidence that I think can, generate that type of, I think help young people release and realize that critical consciousness to I think transform the conditions that continue to regurgitate themselves.
I appreciate the way in which you ended that, because someone put on here, do each of you have ideas you can share to maximize this opportunity that everyone is home to share a connection with communities of color that will help uplift our communities and ignite an appreciation for our strong values? And some of those examples are family, health, quality of life, that have in many ways been attacked by systemic racism.
I'll take a first stab, and shout out to my wife who sent that question. So I feel obligated.
Yeah, I wasn't going to say that.
But I think she hits on some good points. I think as far too often is the case when we talk about Black and Brown communities, low income communities, we talk about deficits and not assets. And I've just been inspired by, I've done some Zoom sessions with some local family friends, and just, the commitment and values that people have towards their kids, sharing and educating. I have a 7-year-old, I'm homeschooling, and, really appreciating and reflecting on the powerhood of fatherhood, and how much closer I've been to my family. And despite the challenges, and I think and I want to throw this out there too, just because we work at Harvard, it doesn't mean that we're not part of these communities, nor are we impacted differently from these conditions, nor is in our families. Like my family doesn't work at Harvard, but just like how genuinely happy some folks are. People are grieving, especially people that have lost loved ones. People are struggling. Both my mother and my sister are work in the healthcare sectors. My sister's a nurse. My mother works at a community-based health center. They go to work every day, and they do that with pride and commitment for their community and love. And I think, that's a huge asset of ours. And there's a concept called cultural wealth, that we a lot of times we look at these things such as education and money and think those are the only assets of folks, and there's a whole host of strengths that we have, skills that we have that's not always recognized. And I think this opportunity in being at home has really given me a chance to reflect on a lot of the just general dopeness and love that our people have, despite the historic marginalization that we've experienced and continue to experience.
Question I've just been asking students and folks to consider, because it is, right, we are experiencing a lot of isolation. It's hard to be this distant physically from the people that we love, is to think about what are the most meaningful human connections that you have had a chance to experience since this pandemic has really hit. And I think it's so important that we do actually take the time to identify and experience those moments of joy, whether it is, tuning in to, D Nice when he does those. There's something like really beautiful about being in community like that, even if it's just for a few minutes. There's something very, I think, very visceral about that, and I think it's important to highlight and celebrate those moments of joy. The different ways that we've found to support each other and to continue those networks, both within and in spite of the restrictions that that are now being placed upon us. I think it's really important to highlight those alongside really, I think, destructive media practices. What does it look like for us to actually lift up those stories of resilience in this particular one? Because those stories are there. They're everywhere, but they're not in the dominant discourse. And I think that becomes an important way to I think to combat a lot of the negativity.
V, since I have you here, someone wanted to build on a statement that you made earlier. So where are we going and what do we refuse to return to? So what does that look like to rebuild community after a crisis like this? How do we heal? And what opportunities are there for us to make change? Are these conversations you're already having in your communities or institutions? Could you expound upon that? And I just want to shout out to Jabari for the Morehouse sweatshirt that was in there.
So I want to use this opportunity to shout out my amazing mentor, Dr. Sean Ginwright, who just published an op-ed article in San Francisco Chronicle on the coronavirus. And I actually I have it here because we're using it in class. But what he says is that the fundamental crisis that we are facing is not COVID-19 or racial disparities alone, but really our capacity to respond in ways that facilitate our collective healing. And he offers, some steps, things like, as we continue with this, what does a National Day of Healing look like? And I even say that, and people are like, well, because we have to dream beyond our current conditions. If we try to find the answers within the current conditions, then we're just going to recreate the same types of oppression. And so we have to think beyond our structures, because our structures were not made for us or by us. And so while we work to dismantle them, we have to simultaneously reimagine what we are going to put instead. And I think this is an opportunity to begin to imagine those spaces. What would you do? What would you do differently? What did you never have a chance to do before? Because those are the conversations I'm having with my friends. The feelings of regret, like, oh, I wish I would have when I had the chance. So when you do have that chance again, what will you do? And how centering dialogue on healing and reconciliation is another thing that he writes about in the article. And I think this is something where what I've noticed is, prior to COVID-19, I was trying to talk about healing and how important it was. And it was oftentimes, oh, that's not really necessary, and this, that, the other. And suddenly there's a lot more, folks are a little more receptive to it. And so I think we need to lean into that opportunity and begin to actually manifest what that would look like. What does it look like to have our needs met and to name those explicitly? And what will we fight to put in place? Because nothing that we have now that actually honors our humanity was given to us. Every single thing that we have now, we had to fight for. And so unfortunately, in this moment, we are going to have to continue fighting and being very clear, having a political clarity on what it is we are fighting for.
I want to bring Jabari and Devin into that, because you have a platform in which so many educators of color come to your events, believe in what you say. What are you thinking about moving this work forward as educators? How can you use that platform?
So as we will continue to reiterate over and over and over again, we're not the experts. And so Jabari and I decided some time ago that we didn't need to be the experts, but we also weren't going to wait for the experts to come around. And so this week in particular, at a time where educators at large, but specifically educators of color, use this time for a necessary respite to disconnect, often travel, we can't go nowhere, right? So the thought that we had for this often overlooked and undervalued collective of educators of color is to what can we provide across this week of respite to get the necessary healing that Christina's talking about, and that like speaks to, as Jabari mentioned earlier, the personal, professional, speaks to the heart, the mind, soul. And so what we did was we reached out to our partners who are providing services, resources, and opportunities to educators of color that we personally can't provide, and made them available. But that started with a listening tour to hear from educators of color, what is it that you need? And so we did 3 days of brainstorm sessions with folks to listen, what is it that you need right now? And throughout the course of this week, we've partnered with a number of organizations who are providing yoga, mindfulness, workouts, webinars, thank you, Tracy, and panel discussions, live podcasts. And so these are all of the things that we heard that folks want. And if we actually even push it a step further, right, there's not professional development happening right now, right? So there are like, what resources are available to educators, period, in terms of distance learning. But what's happening to develop you personally and your growth as an educator? But to Christina's point, when we come out on the other end of this, we can't just be thinking about right now. And so these are the opportunities where we think to ourselves is like, what are the partnerships that we can enlist to best support our community? And so that's where we've shifted our thinking with regard to this physical distancing, not social. This physical distancing that we are experiencing at present is we are missing our TTL fam tremendously right now. And so we wanted to figure out what are the ways that we can stay connected during this time and continue to, Jabari often says, iron sharpens iron. And so how do we build upon the skill sets and expertise and experiences that exist within our community during a time where we can't physically be together, but want to keep building.
I'll jump in really quickly now, and I'll say that like there is so much healing in community, and like we've been so intentional about coining this, like it's physical distancing, not social distancing, to Devin's earlier point, because like there's like a lot to reconcile when you're being told to stay away, when in a time of catastrophe, like you need the closeness, you need the togetherness, you need the solidarity of your community. And so thankfully we have the advent of technology and virtual platforms like Zoom that allow us to create these structures that give us the conduit to like connect with each other in really meaningful ways that allow us to build together through the webinars that are being hosted, ways that allow us to to engage in affinity spaces with each other. And one of my like deep beliefs is that one of the best ways to heal is to share, and like share what's happening at your school, share what's happening in your home. How are you pouring into your community to create this inertia, if you will, like a constant force moving forward in which we are continuously getting better and learning from our neighbor to our left and our right. And the question that was posed earlier is a very real question, is like, what are the ideas that we can generate collectively to strengthen communal ties and to strengthen the ties that we have directly with our family? There's a ton of things happening out there, and we don't know about them. And the way that we would know about them is by creating a space for us to connect with each other and share resources, opportunities, and share like the innovations that really do push our community forward and, quite frankly, really do heal our collective community.
So to the educators, I have a question about, should academic assignments and live online classes be punitive during this time? It appears that there's students who have unseen burdens.
No.
No, the answer is no, absolutely not. We've made it a mandate that we do not penalize students for their lack of submission of assignments or their lack of presence on during Google Hangouts. And the reason being is that there are so many barriers, invisible barriers that exist that potentially prevent our students from engaging in those spaces and prevent our students from doing the assignment, technology being a barrier. We cannot assume that every one of our children has access to a phone, a laptop, an iPad, whatever have you, so that they can engage in the content that is being provided to them. So no, the answer is no, we cannot do that, and we will not do that. It's not equitable to do that.
I'm gonna take a slightly just different approach to answering this question. As somebody who, I don't get to teach young people directly. I wish I could. I'd much rather be teaching 7th graders. I always miss teaching 7th grade. But as somebody who's teaching adults right now, I think we have an opportunity, those of us that are teaching in higher ed, if we're not modeling that, if we're not modeling like restorative ways of honoring their struggles, their trauma that they're experiencing as well, then what are we setting them up to do? And so at baseline, even in my own practices, is checking my students with love for apologizing when they ask for an extension on a deadline, because we have to help adults unlearn those punitive and colonial ways of practicing education. because they're going to go in and be in those schools. And so I think, what are those of us that work with adults right now? How can principals model this? How can administrators in schools, how can we have those conversations with them to model that? Because I'm hearing too many horror stories of administrators that are requiring just absurdity from their teachers. And so it has to be all the way through and through. And so I think the conversation needs to, obviously, we are centering our young people, but it's the adults who are enacting these practices. And we have to get at the core, we have to get at the root cause of that. And that's part of where is that coming from? Why would they follow through on that? Is it because they're being mandated to? How do we then resist that? Because there are teachers who are actively leading that resistance, and we need to draw on their wisdom and expertise, and push, I think, that conversation around, why. And so I think there's opportunities for those of us to model that right now. How do we do that with our own demands and deadlines within all of the institutions of learning?
Speaking of institutions, I have a student here who's working on a degree in education. And she wants to know, how can we take what we are learning in this crisis and create better classrooms? What are some of the benefits of this crisis, and how can we get people to make good things come out of this?
I know a lot of teachers who have flipped the classroom, which is what I would say more typically a college experience compared to high school or middle school. And so in doing so, the students that we were just talking about who are having problems accessing the live class are able to then go back and watch recordings, right? And there are folks who are adding personal touches to the videos, going above and beyond, I think, as some might call it, but actually just adding that personal touch that students are missing right now, that make the content more accessible, but are creating the sort of avenues to access the content, even if they miss the class itself. And so flipping the classroom is one thing that I think, one shining light through all of this.
I have a question for particularly Devin, any of the educators. For folks with young children, so I think in some ways, if you have older kids, middle school or high school, they kind of can be given assignments that can keep them busy, and they can follow the directions themselves and kind of go about their business. But for folks with younger children, how is the educational experience going to impact those? So like 7-year-olds, 8-year-olds, 9-year-olds.
I'm going to let Bari take this one. That's the age group that he's working with directly, but it's on the parents, right? And so when it goes back to the question that he named earlier, the problem he named earlier, which is that the circumstances in the household will determine what's happening to those students.
So it's a really good question. I do have the privilege of leading an elementary school, 630 beautiful children there. And what we have done for these past 5 weeks is we have been doing interweaving and doing skills, a review and return to skills. And it's this idea of like continuously circling back to them so that they are reminded of them and that their edge does not grow dull. And we are now thinking about moving to new content. What that means is not necessarily teaching new standards, but how are we making available to students new text. And what I would say is, like, distance learning, remote learning is not, right? I think we all agree that it's not successful, it's not functioning. The practitioners who are responsible for delivering this learning have not been taught to deliver remote instruction. So it's just not learning. It's not learning and it's not working is what I meant to say. The beautiful thing is that children are incredibly malleable. They are incredibly resilient. And their rate of learning is so rapid, and their rate of growth can happen at such an exponential pace that I have deep belief that when we do return into next year, there is going to be hard work that has to happen that will lay upon the shoulders of our entire school building, not just our teachers, because they can't shoulder that burden alone. But it's my deep belief that when students will re-enter into those spaces, there will be gaps, but we will be able to close those gaps, and they themselves will have like a reignited passion and interest in teaching, in learning. And we certainly are going to have to like recreate the structures to help them reintegrate into a school setting. But it's my deep belief that they will certainly close those gaps and relatively quickly. But right now we are doing skills, like returning to skills to make sure that they don't grow dull.
And Tracy, just to get back to the question that you asked earlier, another shining light that we're hearing from educators is participation and engagement from students who had otherwise exhibited school aversion during this time, right? And I think one of the things that is really interesting and like increased attendance from certain students is, we said this all the time about working with certain students, is students aren't always the most organized, right? And how they interact with their peers outside of school time. And so school functions would often bring folks out. And so thinking about the applications for how distance learning has proven to be more engaging for some subset of students, to think about what are we doing on the other end to figure out how to utilize some of these resources to continue that engagement.
Yeah.
Can I add one more thing really quickly, and I'll stop? Is if we get right social and emotional literacy and techniques and practices, then when our children do return to us in the physical classroom, we will be better practitioners. We will be able to clear away a lot of what impedes learning that happens in the classroom. We'll be able to be more responsive to some of the challenges that our students are dealing with. We'll be more attuned to those things, which makes us better instructors. So if we can really get this period right, if again, centering this idea of social and emotional learning, centering this idea of being responsive to the needs of our students, if we're able to really flex that muscle or build that muscle throughout this period, when we return to the classroom, our teachers will be much more adept in that area. And that's going to increase their practice, in my opinion, tenfold.
Yeah, I think that it's important to continue to recognize and embrace the complexity of what this means for different young people. I think something that was important for me to also be reminded of is that for many young people, not being in schools has removed them from the sites of trauma for so many. And that's one, I think, important piece to remember, and that isn't the case for all students. I think keeping that in mind. The other piece to keep in mind is to not also like just overcredit, overvalue school knowledge. That isn't the only source of like wisdom and knowledge for young people to learn from. Some of the lessons that are coming home are hella whack. Let's just name that. Like some of the activities, I know because I have a lot of friends who are parents who are like, what are they sending home? They're just looking for stuff. And I also have friends who are just, man, by virtue of who they are, they're dope teachers. And I think that we have to center that conversation more, that there are so many opportunities for learning so much of what I've learned in my life. I learned from my dad, from my aunties, and I think we can't take those lessons. I'm not trying to but I think that there's too much decoupling of what is constituting learning for young people. And we need to kind of center on, yes, the emotional and spiritual well-being of young people and their families. And that there is so much lived experiences that become a place. It's the same thing I would tell teachers. Not all teachers are equipped they don't all know all their content knowledge. They have to sometimes learn it just a day ahead of kids. And in that same way, I always ask them, start with what you know, start with what you're confident with. And I feel that that's where I feel like families and parents can start there too. There's so much within all subject areas that we can teach children that are in our homes, just by simply starting from where we are, and to let go of some of that standardized curriculum, most of which is whack anyway. So I think that's a really important piece to distinguish.
I appreciate that. So there are a number of questions on here about Harvard and holding Harvard accountable. And how would you, in your roles as Harvard, as representatives of Harvard, do this work of holding Harvard accountable? And then there's another question, I'm not gonna do the whole thing, but how do you as people of color at Harvard work with people who are smoke and mirrors at Harvard? So I'm gonna put that out there for the three of you.
Which three?
This is being recorded.
You, me, and Rashawn.
Well, you know, a couple of things, Tracy. I mean, as I thought about this, kind of holding Harvard responsible, you know, I work at Harvard. You know, this is not, you know, so the notion of holding Harvard responsible is not us and them. It's not me against them. I mean, I am, you know, I often say, you know, it's difficult to say you're an American in this country, but, you know, damn it, you know, I am, so I have to kind of go with that. So I think one thing is to understand that it's a matter of holding myself accountable as well. So it's not just the university that needs to be held accountable. Each and every part of it needs to be held accountable. And I also think it's important for us to understand, and that we need to get the university to understand, that the university is a member of a community, right? That you know, it has responsibilities as such. It has opportunities, but also responsibilities as such. And I also want to kind of think about the other part of the title for today, which is this notion of peeling back the mask, right? And I think I think it's important. I think one of the things that we need to do is to kind of name that mask, right? Because the university wears a mask that actually does our distancing for us, right? Politically, morally, socially distant, the university is. And it masks, you know, the certainty and the innocence and, you know, the impartiality and the balance and the wisdom and the truth that we pretend to have. And I think we need to take that mask away, right? And then, you know, and when we take that mask away, there's a different kind of accountability. And, you know, I think, you know, I was drawn back to my youth and, you know, to the wisdom of Eldridge Cleaver, you know, who said, you know, there is no more neutrality in the world, right? You're either part of the solution or you're part of the problem, right? Now, it seems trite, you know, it's commonplace today, but we need to understand that. And I think the question is, how do we, within this university setting, as part of this university community, make ourselves accountable and start to think about solutions? Now, I'm not an educator, and the things that you all have been talking about are beyond me, you know, beyond my knowledge and experience. But I do think that the challenge we have and that I see, and what's important, is how we think about putting the resources of this university at the service of those you're teaching and the service of those families and what have you, right? And that, to the second part of your question, is an incredible challenge. It's very difficult to flip the notion of leadership that really infects our university, right? It's its own virus, right? This notion of Harvard as leader, right? And I remember, you know, Tracy, when we talked about kind of what the title of this week, we talked about whether this should be Harvard listens to the community, right? Because everybody's used to Harvard speaking, but we need to position Harvard in a way that it can listen, but more than listen, it can hear, right? You know, it can hear and follow you know, its fellow community members. And so, you know, a lot of that, you know, has to do with reframing and changing the way we think about what this is as an institution and what our responsibilities are in terms of how we hold ourselves accountable. And so I think that's as members of this community, I think it's incumbent upon us to peel back that mask, right? To peel back that mask of neutrality and distance, and and open the gates, you know, in ways that we can because we're here. That's our responsibility, I think.
Tracy, and we've had these conversations. I spoke earlier about who I'm accountable to. And I think my responsibility then is to speak up if I have access to these rooms and in these spaces. I think it's, sorry, my dad's calling me from California. Sorry about that. That I have no choice but to be unapologetic and to show up unapologetically in spaces and to ask those difficult questions and to call bullshit when I see it and when I hear it, because it is important, because that is my responsibility. And I think there is both a privilege and a luxury in me fully accepting that I have nothing to lose but a job. I didn't come here to try to get fired or to lose my job. I just accept that that's a logical possible consequence of how I move through this space. And when I embrace and lean into that, because for me, if I have to compromise my integrity and who I'm really here for and my relationship and commitment to justice and to the babies in our classrooms, then there's no point in me being here anyway. Again, I don't want to lose my job, but I accept that just might happen because that would make sense. Given like the history of this institution and this country. But my belief and my unwavering faith in those possibilities and holding on to that hope, I think allows me to continue to at least try. It's not always easy. It can be painful and violent experience, but that's one way that I try very hard to operate in every single space that I'm in, because that is my responsibility and the promise that I made when I took this job.
I kind of missed the question. I'm having internet connections, but I'll try. If I leave, that's why. I think in in a lot of ways, you can look at the community benefits that Harvard does contribute, to the city of Cambridge and Boston. And, I've seen some of the reports, and it's, tens of millions of dollars that they go to help certain communities. But at the same time, you can argue, is that enough? Especially with the wealth that the university has, the leverage with their brand and the university's access to power, that more can be done. It's well noted that Harvard, along with the other higher ed institutions in Boston, do not pay their fair share of property taxes. And we could debate the merits of that or not. But there are ways that I for one, don't agree with the pilot taxes argument, but I think there are ways that we could be more deliberate with supporting public schools, and not just Harvard, other higher ed institutions as well, helping the neighborhoods that we're in. And a lot of it stems from that we don't consider ourselves to be part of the neighborhoods. We kind of view ourselves to be adjacent to these neighborhoods. And a quick story, I was on a part of a research team, Culture of Health of Boston, and it was a $5 million grant to look at health disparities within 2 Boston neighborhoods. And tremendous faculty who were going to get this grant were having the debate on which 2 cities should they look at. Should they look at West Roxbury and Roxbury? And I was really dumbfounded that these folks would think that Roxbury and West Roxbury were 2 separate cities. And it just showed to me the disconnect that a lot of our faculty members have with the surrounding area. The School of Public Health is in Mission Hill, it's in Roxbury, and so many faculty and students in a large part just come to campus and go home and are so unaware of the surrounding realities of people that live in the neighborhood. Just in that community alone, we have 3 or 4 public housing developments that are literally walled off by all the surrounding institutions. The income disparity in the neighborhood, if you're in Mission, Maine, was predominantly Black and brown, I think the median income is like $19,000 for a household. And if you go 2 blocks up, it's about $88,000 per household. And we have to acknowledge that and do our part to be a part of that. We have to be aware of our history with our surrounding neighborhoods. Harvard has had a shady and troubling history in terms of how we've acquired property, the displacement that we've caused both historically and our role in accelerating gentrification. If you look at any of the neighborhoods that surround our university buildings, rent is unaffordable for anyone who's not a student living in a 4-bedroom apartment with roommates. If you look at the restaurants and small businesses that are now in Black and brown communities, who they cater to is not the residents of these neighborhoods, it's the medical professionals, it's the higher ed professionals, it's the students. And another thing is to challenge faculty. Racism exists in higher ed, and faculty don't always value community engaged approaches. Community engaged approaches are not always respected amongst their peers and colleagues. It's difficult to obtain grants that focus on community efforts, that focus on health disparities, that look at racial disparities. We have to teach our students, especially as a School of Public Health, to embrace community engaged learning, to train them how to engage with communities, that these are not communities that need to have problems solved. We're not saviors, but to learn to recognize expertise, to learn how to be followers, especially when it's community identified issues, and how to be true partners. I saw a comment that says Harvard taking the lead is a virus, and it's true. Sometimes we need to take a back seat and learn to follow and learn to really truly value these partnerships with our communities.
Tracy, can I jump in as a non-Harvard employee? One, I just wanted to note the comment that someone said, housing is not affordable for Harvard students either, which is real from what we've heard. So what Rashawn just spoke to made me think back to what Christina said earlier, which is this idea that Christina noted she is at or in Harvard, but not of Harvard. And I think what Rashawn is speaking to now is this idea that Harvard is in the community, but not necessarily of the community. And so when we talk about accountability, it means something different to the different subsets. So accountability is going to mean one thing to staff at Harvard. It's going to mean another thing to students and alumni. It's going to mean another thing to the community at large, which has prospective students as a part of it. And so it begs the question of who, and this goes back to something David said, Dr. Harris said earlier, I'm going to do it. You earned it, brother. Which is like, whose voices are being heard beyond this panel, whose voices are being heard, but more importantly, because what often happens is you could pull up a seat at the table, which is often the metaphor that people use, but if I didn't set a placemat for you, then you're not eating. So what is the mechanism for decision-making power being in the hands of those that be beyond the walls of Harvard? And so I have one thought I'm going to share, but what I think of is, Mayor Walsh announced a COVID-19 health inequities task force, right? Commissioner Riley recently is launching a remote learning advisory group, which consists of students, parents, business leaders, community members at large. So when we think of whose voices are being heard and having some action or decision-making power, that's the question that I have when everyone is naming sort of the things that can happen. And one specific thing, I think, because I always like to walk away with something specific, is doing some research on your website, right? The professional development for local educators. I'm thinking about my people, of course, right? I wanted to see what do you all have available for specifically for educators of color or for those who are servicing communities of color. And so there's a out of school time learning community, which I imagine right now is inactive, right? everything is out of school time, but nobody's providing actual services. So what are the ways in which resources that Harvard can provide more broadly? And I think beyond, because I think the stipulations are that it's specific to Cambridge and Alston Brighton, but you go beyond that, right? Focus on your community, what you can control, but also I think making it more broadly available to educators who are servicing communities, particularly communities of color, is like, what can that specific department be doing at this time to support educators during this time?
So Devin, can I think that's where, that's exactly where I think we need to go. And I have this idea. So the people who are often left out of these conversations, really, and even among us, are the staff. And when I'm talking about the staff, I'm not talking about the exempt staff, as they're called. I'm talking about the non-exempt staff and the contract workers, right? So we've heard a lot about that recently and about what's happening, I'd like to suggest what happens if we as a university, chose to use our resources differently and understand the inequalities our communities face. A lot of the people that we're talking, who are being kind of laid off or who are being considered for whether they're critical or essential or this, that, or the other, are people of color. These are people who live in our communities. These aren't the PhDs, educated. It's not us, right? But what could we do, right? Well, one thing we could do is we could recognize that they are in fact valuable sources for us. They are in fact incredible resources for us. If we wanted to know what the impact of this virus is having on the ground, which we should want to know, and if we want to know how we should come out the other end of this virus, which we should want to know, why can't these workers be researchers? If we can train people, at the drop of a hat to start to learn how to do contact tracing, why can't we train these people who feed us, who clean up after us? Why can't we train them to be researchers for us and flip the whole notion of what research is, flip the whole notion of who's contributing to our knowledge, flip the whole notion of for whom the university exists, right? But that takes an unbelievable shift in thinking, right? But I think, I think if anything is going to be different on the other side, it has to be that kind of thinking. We have to be able to change perspectives in ways that value, honor, and center people were used to excluding and ignoring and laying off. So that's how Harvard could be accountable in that way, I think, very specific.
Yeah, I appreciate that, because we do have an essential worker who's on here from Harvard, and their question is, how can you help us in the future earn living wages? And what do you think about creating an insurance plan that would help minorities in this case when there's another crisis like this?
Sorry, could you say it one more time, Tracy?
How could we create an insurance plan that would help minorities, and we're speaking of essential workers, in a case like this with COVID-19 when there's another crisis?
I think we have to have a conversation around looking at every single person who is being paid by Harvard and redistributing the money, period. And I know all the different probably labels and names that I could be called for making that statement, but it's there. And we're in a public health crisis. And so I think that's, to me, it just seems logical. I think that's a baseline, and that, I don't know, that's one place to start.
So you have to read this last comment, right? Our colleagues, mostly all people of color, it just got bumped down. What does it say? who work as cleaners are going to need to understand advanced virology. They will be the experts on vectors of transmission and mitigation. There you go, right?
There was one, I'm sorry, that I skipped a while ago, and I apologize to this person. And they said, years ago, Dr. Cornel West was on the Tavis Smiley show, and he spoke about this. How do we go into these grand institutions like Harvard and Princeton and all the rest and allow them not to change you in the way that folks in your hometown can often recognize? And you know, they added that considering that Harvard has a white supremacist legacy, anti-Semitic legacy, and homophobic legacy. So how do you go back into your community?
You never leave. The Bay Area is right behind me. The Bay Area is in me. It's coursing through my veins. And if I ever stop, then there's no point. That's it, because you never leave. And I think I had to learn that while I might be physically gone from the Bay, you can take the girl out the Bay, but you'll never take the Bay out the girl. And I live and die by that mentality in every space. Ask my students, as the people that I work with, is very present. And again, as I already said earlier, I recognize that maybe that means I don't have a job. Okay. But as long as I do, I can't, because if I'm no longer recognizable to the people that I love and that who raised me and made me the person that I am, then I'm useless. And there's no point. There's no point to any of it. And so, period, the end. And when it comes to, anytime I think about like tables and seats at the table, I think of Left Eye. And that's what we need to do.
No,
go ahead, David.
Well, no, I was going to say, I mean, I, you know, that seat at the table business, I mean, from my perspective, I think the issue is let's get rid of the table, right? Let's sit in circle, right? The table has a limited number of seats. Let's sit in circle that can constantly and infinitely expand, and we can draw more and more people into our conversations. I mean, and again, I do think it's the need to disrupt the standard ways of operating and seeing. It's not, you know, just a seat at the table, then you become like the other people sitting around the table. I mean, I think we need to, so that's what I was laughing at.
Yeah, and I would say, like in my role, practicing what I preach, you know, like I spend my time, just as much time on campus as I do out in the community, talking to residents, working with community-based organizations, you know, connected with my family, you know, like what was JC say, you know, they say you can't go back home. You know, when I heard that when I was back home, and, you know, and make sure you stay connected, but at the same time, you do get disconnected, you know, so, you know, I'm not hanging on the corners, you know, I'm not, you know, at every community meeting when I had a different role, and being aware of that, and knowing that my perspectives at many times are represented. I'm an agent of Harvard, and I have to own that. And when I'm in that space, you know, I need to, many times I get invited to spaces to be the voice of community, and I push back against that. And I said, these folks have not asked me to speak for them. So I can speak on what it's like to work for Harvard in a community engaged capacity. But if you want their opinion, you know, you need to invite those to the table. And if you need help identifying those folks, let me know. But you know, just practicing humility and really keeping it real.
Thank you. There are a lot of more questions I'm not going to be able to get to, but I'd just like to ask each one of you to leave us with a thought, a question for the participants to think about.
Thank you all for joining us tonight. I know everybody has lots of things to do, and thank you for letting me be on here with you. All are amazing. It was an honor to be on this panel with you.
You gotta leave a thought, V, quote, something.
Unmute now. You gotta unmute yourself. Okay.
Oh, we're supposed to, I thought you were telling all the participants.
No, you, the panelists.
Oh. Left eye the table.
I have one. I wish I got this out earlier. Just a thought for folks to consider all of our young people that are incarcerated, that are in the juvenile justice system, and the terrible conditions that they're faced with social isolation, where these young folks are spending 23 hours out of their day in isolation, and that we really need to address this and get our young folks out of these prisons.
So let me just follow up. Okay.
Go ahead, Dr. Harris. No, you go, Dr. Harris.
Oh, no, man, don't. No, not if you're going to call me that.
All right, I'll just drop really quickly that I want to just challenge everybody to think about what are they going to do to ensure that their communities are not only intact when this passes, because it will pass, but to ensure that things are not as they were when we entered into this space. I think this is an inflection point in humanity for us to act, think, and behave differently. And it would be a crime for us not to use this moment right here to go into the world differently tomorrow.
And, and I'll say, in memory of my dear friend, Lily A. Estes of Richmond, Virginia, I think we have this idea or tendency to think of doors opening, that white privilege, the door is open, and when we come, the door is closed. And what Harvard and the kinds of education we have teaches us as well, we need to open the door wider and let more people through. And Lily and I recognize that that's not true, that there's a wall holding up that door, and there's a wall separating one side from the other. And it's our job and our work, personally and as an institution, to tear down that wall. That's a question of structural change. It's not a matter of letting a few more people through the door. All of us need to recognize, name, and dismantle the walls that separate us. I think we can all do that.
I'm gonna start by, I was held accountable by my sister, Jo Prasad. Christina, my apologies, you have earned doctor credentials as well. So I wanna make sure addressing you as well as Dr. V. So I apologize for not doing so sooner. My closing thoughts are to check on your people. Folks are, I hate to sound morbid, folks are dying in isolation, right? Folks don't know when their final goodbyes are. And more importantly, nothing about what is happening right now is normal. And so the extent to which, I think the question came up earlier, is what can we do specifically for communities of color? And it's so expansive to think about, and that can be overwhelming, but the thing that you can do, you have personal connections within your immediate community that is within your control. And I think these relationships that are strengthened right now, as many folks have named, that needs to carry forward, because when we come out on the other side of this, there will be lasting effects of this. And so the extent to which now and for months to come, we are checking in on our people is the way that we can stay connected, continue to support each other, and continue to uplift.
Casey, could I just give one other shout? Somebody asked, I need to make sure that I say, I think another thing that we can do as a university, and I think we should think about, and our students working on this, is the extent to which we can make our university housing available for people being released from incarceration, in the hope that we will get some more people out from incarceration. I think Suffolk University and some other schools have started doing this. And if people out there are looking for some real proactive thing to do, we should be on that.
Thank you. I appreciate you mentioning that. So folks, thank you for joining this webinar. Really appreciate your participation through questions. When you register, got your email addresses, so we'll send you a survey to find out if you want to get more information, if we come up with any resources, but we will stay connected. So thank you very much. Check out the